sponsored by Orthopaedic Associates of Muskegon. It is the Lakeshore's largest orthopedic practice with 18 physicians on the team. Dr. James Ringler is among them. I should also say, Dr. Ringler, that you are the largest Lakeshore orthopedic practice dealing with traumatic injury to the joints and bones, correct?
We are. Over the last several years, we have become a leader in orthopedic trauma care on the Lakeshore. We've seen our practice grow immensely over the last few years.
When you talk about trauma to joints and bones, there are obviously a variety of ways that people receive those injuries.
There sure are. And we see the whole gamut from high-speed motor vehicle accidents to motorcycle crashes. But you know, we also see a lot of injuries as a result of simple falls. Our elderly population is certainly growing, and so we see a variety of hip fractures and simple fractures that present both to the emergency room as well as to our urgent care.
Yeah, which is a real benefit because it allows for a type of coverage that's wonderful. But talk about the benefits of people being able to present in either place.
Sure. Well, you know, with those high-speed injuries, obviously those patients are presenting to the emergency room where we have a high level of care. You know, we've coordinated very well with Mercy Health and their trauma team and the staff at the hospital and deliver really superior care. But for those more simple injuries, we can treat patients expeditiously, efficiently by simply presenting to our urgent care, and they can receive treatment that they need on the spot very simply.
Including the proximity to surgery if that's the necessary treatment, right?
Sure. Many of our patients do benefit from surgical intervention. Certainly not all injuries require surgery, but in orthopedics, certainly a vast majority of our patients require some sort of intervention. And you know, we're one of the leaders in presentation to the OR in a timely fashion. We take pride in alleviating patients' pain, but certainly we know that presenting to the operating room sooner rather than later decreases morbidity and improves outcomes for our patients.
The road to recovery when you're talking about traumatic injuries is often a long one. You don't stop at the operating room. You follow them all the way down that long road.
Yeah, we sure don't. In fact, oftentimes surgery is the first step in a long process, and so we see our patients repeatedly in the office. We have a large team of physicians that both specialize in orthopedic trauma care, but also in the other types of injuries. And so if you injured your ACL, we need sports medicine doctors. If there's a spine fracture, we utilize our spine surgeons who are all subspecially trained in this area. As I mentioned, we have a significant proportion of elderly patients, and so we have a bone health program that allows us to not only treat their fracture, but try and prevent those fractures down the road. And we find that that's very important in trying to prevent, you know, long-term injuries and problems as they go forward.
All right, well, if you would like to learn more about the many areas of specialty at Orthopaedic Associates of Muskegon, you may do so on their website. We have put a link to it on ours at 13onyourside.com. Dr. Ringler, thanks.
Thank you.